Good afternoon, dear participants of the symposium. It is my pleasure to share with you some highlights of the study that we recently conducted and completed. And we are the World Bank Health Team in Kosovo, and I would like to acknowledge the contribution of my co-authors with the name here. And the study is a situational assessment of the state of NCDs in Kosovo. So the objective of the study is to put together a comprehensive picture of the state of NCDs in Kosovo, and the motivation is quite clear. As we started looking at the situation, we see that there is a huge scarcity in data on Kosovo, and I mean we actually see that very clearly from the previous presentation. Moreover, there are some studies here and there, but they are in one or two areas, and we don't really see the situation of NCDs in its totalities. So we set out with quite an ambitious goal of assessing the situation of NCDs in this more or less totality, if we can say it in a humble way, where we look at risk factors, at health and economic burdens, at the risk detections and early risk reduction and early detection, as well as management of NCDs, and also reviews the situation of policies and regulations relating to NCD in Kosovo. So the study relied on review of existing literatures, legal documents, protocols, studies, also analyzing administrative data, mostly from CAS, but also from other sources. We also conducted some estimation and projection ourselves, and also conducted an interview of key informants. So there's a disclaimer here. We rely mostly on available data, and so the study, as we actually see later on, we still see a huge gap in current knowledge in all of these 5 areas of inquiries about the situation in Kosovo. However, as I said, this is more or less the first attempt to really actually see NCDs with also all the multiple key dimensions. And in the interest of time, I will only walk through some few key highlights of the results, and we have a report that is published, and you are always welcome to download it and take a look when you have time later. Jumping right into the risk factors. As we just heard, there's a behavioral, metabolic, and environmental and occupational risk for NCDs. And in the report, we actually look at them all, and here's the situation in Europe and Central Asia in 2020. We see that all these risk factors for NCDs account for a huge number of disability-adjusted life years, which is the reflection of disease burden in the region. In this regard, Kosovo compared quite unfavorably with peers and aspirational peers. Peers in our term, as we define, including countries in the Western Balkans, and aspirational peers are small, former socialist, pretty much new member states of the EU, such as Estonia, Croatia, and so on. And on smoking prevalence in general, Kosovo is on par with peers, but when you look at the rate among adult males, you see it's very high. Almost half of the male in the adult group smoke. And also, I see what is very alarming is the high rate of secondhand smoking at home, because here this is reported from a youth survey, and youth reported that they are exposed to secondhand smoking at home, and actually that's also not only have the harmful effect on their health, but also introduce them very early on in life into the practice of smoking. On dietary diversity, Kosovo has a very low rate, and the rate is actually particularly low among the group of Roma, Ashkali, and Egyptian population. Air pollution is directly linked to premature death and morbidity, and this is just a review of a study. It is estimated that 350 deaths occurred each year prematurely due to air pollution. Kosovo has two coal plants that contribute, and Kosovo is the biggest contributor to the PM 2.5 pollutant in the Western Balkans, and this one is the most damaging to health due to its ability to get into the human organs. And it is estimated that air pollution impact on
Shutter
health
speed settings.
translate to the
Right.
total health
Gain,
cost
areas,
of up to
ISO,
352
white
million
balance.
euros a
white
year.
balance, okay.
Yes. White balance remote here.
Remote, okay.
On health burden of NCDs, we just heard in the European region, 90% of deaths are attributed to NCDs. The picture in Kosovo, I think, is more or less the same, because if you look at the graph on the left-hand side, between, and this is data from the country, as you can see, a lot of fluctuations, probably due to the issue of quality more than the pattern of deaths.
Shutter speed settings.
Deaths with known
How
causes
can
are attributed to NCDs, and I want to emphasize the word known.
okay,
Because if you look at the
rolling.
graph on the
Tamam.
right-hand side, between 20 to 30% of deaths are not attributed to a specific cause.
Okay.
So if you,
F
let's say, distribute
minimum.
this percentage, you probably get into something 90%
4.
of deaths.
Okay.
are due to
Low life
NCDs.
performances.
Also,
Nice.
to
Okay.
note is, even though we tend to think of
focus.
NCDs as the issue of middle age or elderly,
zoom.
here you see in the age group of 20 to 29,
Okay, nice.
nearly 30% of
Oh,
deaths
perfect,
are also
perfect.
attributed to a non-communicable disease condition.
How can connect audio?
Especially for men
Yes.
cancer increased by 2
Is
to
it
2
rela?
between 2012 and 2019. The main cancers are the one from respiratory and
But we have
digestive breast cancer,
road
and
bicycle and
female
this mic is jack.
Yes,
and
it's
this
here.
is an absolute number, I mean,
Okay.
normalized by the population. So you see a huge increase.
Şuraya. Okay,
Partly, I
understand.
think, due to the disease pattern itself, partly maybe due to the progress in screening and
Also,
early
this
detection.
type
Mindful.
You will see later
Sorry?
that
Mindful.
from our perspective,
non-proto.
we think
Yes,
it's
another,
Okay.
to improve when it comes to that progress. Most cancers are detected from NCCK, but
Manual
also
settings.
quite a large number are
Just a minute.
detected from family medicine centers and private hospitals.
Okay,
Just
menu
to
settings.
stress
I'm
the role of
rolling.
this level of parental,
Iris is
for
F
NCD,
and rolling.
not
Shutter
only
speed.
prevention and
Yes,
management, but also
okay.
detection here.
gain and roll it.
Okay.
Zoom and you put
I
here.
would say that the
Okay.
death due to
Focus
CVD,
and
cardiovascular
autofocus
disease,
is
seem to be
Okay, autofocus and
slightly
monofocus.
lower
Okay.
as percentage
Is nice.
compared to other countries.
Okay,
in
understand.
the,
Yes,
aspirational peer groups, and keeping in mind the fact that Kosovo has a very young population compared to these countries.
We'll assist if you have any problem.
When it comes to diabetes, and this data is from the report from the municipalities, and you can see here there's a huge variation in reported number of insulin dependent patients, normalized by population size as well. Between you look at Jillian compared to Pristina per year. And I guess we really do not have the capacity or capability to look into kind of the reason behind the number, but it is very hard to believe that the pattern of disease is so different across municipalities, so it really point to some potential issues with data or access. There's also a significant burden of mental health, being a country that just come out from a war not too long ago. It is estimated that there are more than 900,000 people adults that survived the war in the 90s. And among these, two-thirds, if you sum up, the people that suffer on the right side, suffer from post-traumatic stress disorder, major depression, either or and both. You have about two-thirds of them that have this condition. And the problem is particularly severe among female war survivors, as you can see there on the graph on the left-hand side. We also attempt to estimate the economic cost of NCDs, and it's reflected. I think it's you see the aggregate picture from the previous presentation for the vision. But here this is specifically for Kosovo, and of course it's another heroic exercise because due to the lack of data and everything. However, as you can see here, the cost is reflected not only in the direct cost of the health system for treating the diseases, but it's actually a much more significant portion of the cost is indirect cost to the society due to loss of productivity. So here on the left side, you see that these estimated costs for 6 main NCDs, colorectal cancer, lung cancer, and so on, in 2023. The cost basis simulation. So it's not a real cost that is bound to the health sector because it is assumed that all the known cases receive proper treatment. So, and in that case, based on the current labor force participation in the country, you will see that depending on the conditions, the healthcare cost is significantly smaller than the indirect cost, which is the productivity cost loss, the loss due to loss of productivity. And there are two reasons for that. First is premature death, and second is due to morbidity. When people living with disabilities, they cannot show up to work, or they show up to work and say they are not productive. And that is the productivity cost of absenteeism. And if you aggregate all of this, you will see, depending on the condition, for here, hypertension is the one that has the largest cost, both in terms of healthcare cost and also in terms of productivity cost, because people live long, they live with mobility. And for cancer, healthcare cost is quite small, but as you probably know why people pretty much here die very quickly after the cancer is detected. So very briefly on risk reduction and early detection of NCDs as a practice currently present in the country. Despite the high burden of cancer, we see that the practice of cancer screening leaves much to desire. About 90% of the women aged 54 or above do not have a breast cancer screening. There is, as you see here on the graph on the right-hand side, mammography is done in the public sector, at least, in both hospital setting and through mobile mammography. And the mobile mammography program has been picking up quite well and has been providing access to people, especially in the rural and remote areas. However, the number remains quite small, and you see the percentage is low compared to the need and what it should be in the population. Cervical cancer also remained extremely low. About 1% of eligible women actually has been tested for cervical cancer. Nearly all lung, actually 90% of lung cancer are diagnosed at an advanced and inoperable stage. Well, lung cancer is also typical as is the case, but in some of the aspirational peer countries, the percentage would be something like 30 to 40%. Here in Kosovo, it's 90%. On management of NCD, we actually look at the all kind of a different level of the system. The macro level, at the system level, things are national clinical guidelines, whether there is a basic package of care that includes NCDs and guaranteed services to the population, situation of supply and medicines and medical equipment. On the meso level, which is the organizational level, we look at the healthcare workforce, coordination of care, especially the practice of referral and the range of services provided. And at the macro level, which is a clinical team, there's a lot of it that has to be with, deal with interactions with clients or with patients, and even also a lot of it has to do with characteristics of the patients and adhering to clinical pathway and guidelines. Very briefly here, I think this is an area that has been mostly researched in the context of Kosovo. There is surprisingly a limited number of national clinical guidelines for NCD. So at the time that we conducted this study, which is a year ago, there were 6 guidelines in for NCDs. And as you know, there's no benefit package, even though people are entitled to free services, drug most of the time is lacking. I think for diabetes patients, the only thing that's guaranteed is insulin. We compared the practice of policies and regulations with the WHO baseline recommendations for tobacco and alcohol, at least in this presentation that I can show you. And we see that actually there's quite a well-developed set of policies and regulations. The only issue is the implementation and enforcement. For example, excise tax on tobacco products is applied, although it still remains below the international standard. There is also a ban of smoking in public areas. However, I think we know how the ban has been enforced so far. For alcohol, the policies and regulations remain less developed, but there are also some. But you can see here, the excise tax on spirits in Kosovo is extremely low compared to other countries in the European Union. Actually, there's a parallel session now that my colleague from the World Bank is actually presenting on the issue of the excise tax here in Kosovo as a result of our different analysis as well. So with all of this, we actually come up with a very comprehensive set of recommendations, and maybe in the interest of time, I just want to read through a few. A national program for prevention of smoking, particularly among youth, the condition-specific registry to improve data quality and monitoring of NCDs, as you can already see, implement a list of patients at primary care facilities. I think we heard about that from the previous session. As well as many other recommendations for the medium and the long term that I think I'm not going to read them, but just I guess you can access this in your own time. So thank you very much for your attention.